How to use the Safe AQ-UG blood glucose and uric acid monitoring system. The Safe AQ-UG blood glucose and uric acid monitoring system is simple to use for any person, especially for patients with diabetes. Wash your hands, rinse and dry completely. Rub your hands to increase blood flow. Screw off the cap of the lancing device. Insert a lancet into the lancet holder and push down until it is fully seated. Note that the lancet is one-time use only. Twist off the protective cap until it separates from the lancet. Replace the lancing device cap and set the puncture depth to the desired number. Pull back the cocking control until it makes a click, and then release. Now, the lancing device is ready to be used. Insert the chip into the device slot to calibrate. Remove a new test strip within the valid expiration date from the vial of blood glucose test strips and uric acid test strips. After taking out the strips, immediately cover the vials to avoid losing efficacy. Insert the test strips into their respective strip slots. It is suggested to use up the test strips within 3 minutes. The meter will turn on automatically. When the blood symbol starts blinking, the meter is ready to be used. Use an alcohol swab at the blood sample site for disinfection. Be careful not to use iodine or any disinfectant containing iodine disinfectant. Once the alcohol has evaporated cleanly, align the prepared puncture device with the disinfected skin and press the button to collect the blood. To obtain the best accurate results, wipe off the first drop of blood and squeeze another. Apply the blood sample to the opening of the absorbent channel of the blood glucose test strip and the uric acid test strip until the confirmation window is fully covered with blood. The meter will display your blood glucose value after 5 seconds, and your uric acid value after 30 seconds. Push the strip ejector to eject the tested strips automatically. Cover the lancet with the protective cap, pull it out and dispose of it properly according to medical waste management regulations.